very first thing you see a person on the ground, you want to make sure that the scene is safe. You're tapping this person. Once they go, you're back at the patient or victim, and you're going to check the carotid artery, and you're checking, looking at the chest to see if the chest is rising. If this person is breathing and have a pulse, you're simply in first aid mode. It's a yes. And in first aid mode, you're checking for injuries. I always put question marks here because you have to ask yourself, does this person have any injuries? If they have any injuries, you can treat them. You're looking for medical identification to help out. And then last but not least, you're going to monitor. Simply meaning every 2 minutes, you're going to keep checking until the paramedics arrive that this person is breathing and they have a pulse. If this person is not breathing, no pulse, or if you're not sure if they're breathing, you have to start your compressions. And I always tell everyone, simply put, if you start your compression and the person starts moving, you simply stop. You may bounce from CPR mode to first aid mode, just like that. They may begin responding, because who knows, this person could have had a medical situation, or someone could have simply knocked them out, and now they regain consciousness. But CPR is 30 compressions, 2 breaths, at the rate of 100 to 120 beats per minute. For adults and children, it's about 2 inches deep. And then what we also explain is the rationale behind giving compressions versus not giving compressions. So back in the day, a lot of people used to follow an acronym called ABCs. And ABC is airway, breathing, circulation. So what we used to do back in the day, we would do a head tilt, chin lift, look, listen, and feel for breathing. If this person wasn't breathing, you would go to, opening airway was A, and you go to B and give a breath, checking to see if they had a patent airway. If you were able to get air in there, you would know that this person is unconscious, but it's not because they were choking, because you were able to move air. But if it locked up, you would know that this person possibly choked on something. And once you discover the person was choking, you would go right into your CPR, give 30 compressions. After 30 compressions, you'll look to see if there's anything in there. If it is, you'll take it out and continue doing that until this person began responding. And C has always been circulation. The problem was always that, and we're talking about once we hit the 90s, because back in the day we would put our lips just on anyone. But the problem was, as time went on, closer and closer to COVID era, people started being afraid to put their lips on a person. And this is why I draw this.